All right, good morning. This is the PowerPoint on career paths and modalities. Most jobs in this category involve interactions with clinical users, leadership, or education. So radiography is a building block to many career paths. We can go into ultrasound, CT, MRI, CAT scan, or cath lab, or interventional radiology, radiology assistant, sales. Non-clinical roles, PACS administrator, educator, sales application specialist, management. These roles move away from patient care as the primary job. So if you get tired of doing portables all day or working in OR or picking up matrix shifts, you can try something that has nothing to do with patient care and have to do with just educating the staff, doing sales for like different medical organizations or supply companies. So it used to be called the PACS system. Most people still call it PACS, the Picture Archiving Computer System Administrator, or now it's called MIPS, Medical Imaging Management and Processing System. I still call it PACS, but the new term is MIPS, Medical Imaging Management and Processing Systems. So basically, this has anything to do with the technology side of the computer, kind of like the AI, or not really AI yet, but just mainly having to do with images crossing over to the system or things need to be corrected. So quick video on what is a PACS analyst. We'll watch this in class. Again, PACS MIPS administrator identifies, troubleshoots, and resolves software and hardware problems related to picture archiving and communication system, PACS or MIPS, and radiology related equipment. So most likely, if your portable machine isn't sending all the images over, if your routine room isn't sending images over, or what if you sent images over where the marker was on the wrong side and needed to fix it? Just simple things like that. Or for routine maintenance of the PACS system. PACS MIPS administrator work schedule Monday through Friday, usually business hours 8 to 4:30. There is usually a call because the hospitals are on 24/7. Other things they can help you with is like if you're switching over computer systems from one major EMR to another, they can help with that, with the transition. They can also help with like importing CDs from other organizations. So let's say you're seeing at UT Health, but now you're seeing at Memorial Hermann, but the software isn't exactly the same, or there was a study done at UT that you need to import to the Memorial Hermann system. Well, PACS or MIPS administrators can help you out with that. PACS MIPS administrator qualifications, usually former lead technologists or PACS super users. Usually most PACS people or some PACS people come from CT mainly because they're used to doing a lot of trauma cases without having the patient's information, and then they'll merge the charts later. So they're really good at, they usually have to do that like almost every single day. Good communication skills needed, ability to multitask, and they usually do the QA QC. So if you're sending over non-quality images, then they can help you work through it, maybe kind of changing your region of interest, your ROIs, or helping you with your brightness or contrast scales. PACS MIPS administrator training. Some do not require any training to become a PACS administrator. You progress at a hospital as a tech into PACS. Background in education with IT computer science always a plus. The following certifications are available, not really required, but it doesn't hurt to have these. Certified Imaging Informatics Professional, the CIIP, or the Certified PACS System Analyst, CPSA. The ABII, American Board of Imaging Informatics. ABII is the board that grants the credential of Certified Imaging Informatics Professional, the CIIP. That's important to remember. Title would look like John Doe, bachelor's in RT in radiology, CT, and CIIP. A similar board to the ARRT. The ABII examination, to qualify for the exam, there's a 7-point system. You have to have experience, max up 4 points, one per every year of imaging as an imaging professional. The education, max up 4 points for this one. Certificate in imaging informatics, you get 1 point for that. If you have an AA or an AS, that gives you 2 points. Bachelor's degree gives you 3 points. Master's or doctorate automatically gives you 4 points. Continuing education, max of 4 points. 1 point for each 18 hours of CE credit taken on imaging informatics. The exam for the ABII, the certification exam, is double the price of our X-ray one, so it's about $500. Has less questions than our registry. This one only has 180 questions on the exam with these specific contents: procurement, project management, operations, communications, training and education, image systems management, information technology. Credentials must be renewed every 2 years, just like our X-ray degree. Just like our X-ray degree, 24 hours, continuing education credits in the content areas above. So it's got to be in these specific subjects. The salary for PACS MIPS is around 80,000 plus or minus 10,000 per experience. So we've talked about PACS. Let's talk about educators. So tutors usually fall into the role of educators. Educator faculty role, training the future generation of X-ray technologists. Variety of duties includes aiding in recruitment and retention. So a lot of times we'll help you try to get a job during your clinical rotations. Development of courses. So we find the textbooks, we read all the textbooks and make sure that they are in requirements. Do they fulfill all the requirements of the ASRT and JCERT? Overseeing clinical progress of students. So these are the main roles of educators or faculty. Work schedule, it says Monday through Friday, business hours, generally 8-hour shifts, no call, but administrative faculty responsibilities may extend throughout the workday. Usually have holidays off, including spring break. It says 8 hours, but usually students will call you at 5 in the morning or call you up until midnight each evening. Usually if there's like snow days, the school might be closed, but students are always calling, hey, is the school still closed? HISD is closed. Does that mean HCC is closed? So there's always responsibilities that go beyond the regular workday. Educator qualifications: experience working with students, experience teaching students in a higher education setting, professionalism. So experience includes being a tutor. So I was a tutor. Mr. Daza was a tutor, and then we just progressed eventually into the role of educator. Mr. Daza went, I believe, into teaching about 3 years after being a tech. Me, I waited about 12 years before I fully switched over. Educator training. To teach, you must have a degree higher than the degree your program offers. For example, at HCC, to teach full-time, you need to have a bachelor's degree. HCC offers an associate degree. We don't have a bachelor's degree in radiological sciences yet. Most educators have a bachelor's degree at the minimum. Program directors require a master's degree. About half of your faculty have a master's degree already, and some of us are working on our doctorate. Educator salary. The national average salary for an educator in the United States is about $80,000 per year. It's kind of similar to almost what new techs are starting out right now. Entry-level salaries are roughly $60,000 a year, and senior-level salaries are roughly $90,000 a year. So again, it's that plus or minus 10 or 20,000 from the like base salary. So we talked about educators, we talked about PACS and MIPS. Now we'll talk about application specialists and sales reps. So that means you can work for GE, Shimatsu, Philips, those major companies. Another quick video on being an application specialist. So hopefully this gives you guys some examples of what you can do for your presentation starting next week. Sales application specialists, selling or sales reps and training application specialists of new equipment installs at hospitals, outpatient centers, and various other radiologic departments. May be in charge of a certain region or area, will service the entire region. So that means you could be the sales or app specialist for all of Houston, or you could be the sales and rep specialist of all of Texas. So it just depends on the company and how big your organization is. So you can work for the following companies: GE Healthcare, Siemens, Shimadzu, Philips, Fujifilm, Canon, Konica Minolta, Agfa, Carestream. These are all of the imaging companies, but let's say you spend a lot of time in OR, maybe you could work for some of the surgical reps, like you could work for Boston Scientific or Stryker, any of those major companies. You don't have to limit yourself just to imaging. Sales application specialist schedules, Monday through Friday, some weekends, different shifts, but mainly during business hours. A lot of travel. Some require upwards of 75 to 90% of travel, especially application specialists. So whenever, like HCA just got a new fluoro machine, there was a girl that travels around. She was in Dallas like the week before, but this week she's in Houston trying to show the techs how to use the fluoro machine. Both can work from home for major companies like GE or Siemens, but a lot of times the techs want someone in-house, so that means you'll have to visit the hospital and spend about a week there to kind of onboard them or teach them how to use the machine. Sales rep qualifications: associate degree with relevant experience. Bachelors are usually preferred. Previous sales experience. Ability to work independently. You're usually going to be by yourself. You'll see a lot of the vendors when you go up to the surgery suites, they usually wear their red bonnets. And they're kind of instructing the surgeons how to use the machinery. So even though they're not surgeons, they know how to do the procedure, and they're kind of guiding the surgeon on how to work with a patient with that new tool. Application specialist qualifications include an associate's degree with relevant experience. A bachelor's degree is preferred. Previous teaching experience, ability to work independently again. So the training, no training programs, things to do to make yourself stand out. Knowledge of the company's latest line of equipment. For sales representatives, degree in business or previous sales experience. For application specialists, previous teaching experience. So if you're a teacher, you could become an app specialist. Two of our instructors were application specialists before that are currently current faculty, but yeah, so Miss Lobren and Miss Marcel were application specialists before for different companies. Sales rep, app specialist salary. The national average salary for a medical imaging sales rep, application specialist in the U.S. is about $80,000 per year, very similar to teaching. Commissions plus or minus $10,000 depending on experience. So you could also go into management. Lead, develop, or achieve, something the military says. Management roles, variety of roles in management: supervisor, lead technologist, radiology manager, director of radiology. As you progress through the career ladder, more job responsibilities will be added. And that's important to remember. So, management schedules: for the supervisor, lead tech, any shift, anytime. For manager, director, during regular business hours, Monday through Friday, for the most part, some call. So very similar to teaching or being faculty. Management qualifications include lead technologists and supervisors can advance with just associate's degrees and experience. Managers and directors usually have advanced degrees, either a bachelor's or master's degree. Coursework can be in business, some bachelor's and master's in radiologic sciences, tailored degrees to management. So you could go to MD Anderson and get a management degree from them. Management training, again, career ladder, usually starts at the supervisor, lead tech role. You can progress and gain more experience in this role. The easier it is to transition to radiology manager or director if you just work your way up. You can be hired from outside, but most people trust people that they've already worked with. Various college universities have coursework in management. The Association for Medical Imaging Management, AHRA, has a certification for management training. Again, here's that organization, AHRA, the Association of Medical Imaging Management, gives you this certification. It's like ART, but radiology management. Administers tests for the Certified Radiology Administrator, the CRA, and your credential would look like this. So you would have a bachelor's degree in X-ray, CT, and then here's your CRA, Certified Radiology Administrator. The CRA credential, to qualify to take the exam, there is a 7-point system, just like the other one, and the same type of qualifications. Experience, max of 4 points, 1 point for each year as an imaging administrator. Education, again, same thing, 4 points. AA in radiologic program, so you already get one just for graduating an X-ray school, 2 points for that. If you get a bachelor's degree, that actually gives you an extra point, so you get 3 points. Master's or doctorate's 4 points. So very similar to the one you can get for PACS or MEMS. Credentials, max 1 point, certified in ARRT, ARDMS, NMTCB, and RCC. So if you got a certification in X-ray, you get 1 point, ultrasound, nuclear medicine. CRA credential exam is similar to the other ones, $500, double the price of an X-ray one. Same amount of questions as the PACS or MEMS. 180 questions exam on these content areas. Human Resource Management, HR. Assets Resource Management, AM. Fiscal Management, FM. Operations Management, OM. Communication and Information Management, CI. Credentials must be renewed every 3 years, so it's different than ours, which is every 2. And this one requires more CE credentials. So ours is only 24. This one requires 36 CE hours in these specific areas listed above. Management salary. Manager salary is $110,000 per year, plus or minus $20,000 per experience. So let's take a quick pause and talk about radiation safety again. So who is in charge of radiation safety? We are all responsible for radiation safety as techs, but the one who's in charge is the radiation safety officer. It's sometimes a health physicist. In the RSO, the radiation safety officer is responsible for maintaining radiation safety in a workplace setting. A medical physicist, a researcher, usually has a graduate degree, medical physics, health physics, etc. So this person actually comes in once a year and checks our equipment. This would be like Dr. Ho here. A dosimetrist, that's our badges that we wear in clinic. Landauer analyzes dosimeters for companies. Industry radiographers, starting at $21 to $42 an hour. Checks for craps and pipes and planes. And you can go to this website here, and they can talk about being certified for industry radiography. So now that we've talked about non-clinical roles, let's talk. This is basically a separate PowerPoint, but it's on bone density. This is something that we do as X-ray techs. Those of you who have been to Texas Children's or some outpatient places like Kelsey-Seybold, they have a bone density machine, and they can be operated by the mammo techs or by the X-ray techs. This is called dual energy X-ray absorption, or a DEXA scan, usually to assess bone mass and deterioration of the skeletal system, diagnosing osteoporosis negative 2.5 or less. Bone mineral density BMD is based on T and Z scores. So all of this is important to remember. It's usually done for mostly geriatric patients, but in some instances it can be done for younger people as well who are prone to fractures. Some places with weight management, they can also do a BMI measurement as well. So again, it measures T scores and Z scores. What the difference is, T scores compare patients that of a young normal patient, the same sex and ethnic background. And the Z-score compares the patient with an average individual of the same age and sex. So the normal range for the T-score is no less than -1 is normal, Osteopenia is between -1 and -2.5. Osteoporosis is more severe, so that has a -2.5 or less bone density score. Then you have severe osteoporosis is -2.5 or less with present fracture. So it'd be like -3, -5, -6, but usually it doesn't go higher than like -3.5. So these are the people who are most common to um, a fracture in their back or fracture in their hips. We look at the Z-score here. Most used when patient is a child, teen, woman who is still having their menstrual cycle, or younger men. So this one here, the T-score, is mostly for like geriatric patients, and this one here is for everyone else. A normal Z-score is above a -2. Low Z-scores is -2 or less, meaning like a -3, -4, -5. Bone densitometry is used to measure BMD, bone mineral density, detects bone loss, establishes the diagnosis of osteoporosis. It assesses an individual's risk for fracture, assesses patient's response to osteoporosis therapy like Prolia. Perform vertebral fractures assessments. It's called a FRAC score. So some people could be on Prolia, could be on another one called Boniva. Common sites of measurement is the lumbar spine, L1 through L4. The femur is right here through the neck. Forearm can be scanned in some cases if there is metal in the hip or back. So if someone's had a lumbar fusion, if they've had a hip replacement, then we can use the forearm as an alternate. So this is a lateral view. We don't really do laterals on bone densities. I've never done one, but basically just showing you that usually I do them AP, but it kind of shows you the different bones here. So this would be, looks like I guess they're saying this is 4, that would be 5, 3 and 2, 1, and then we have ribs here. But very similar to what you'll see on a regular scan. Usually, again, we don't do the lateral, but in this case, it gives you their height, their weight, birth date, and yeah, they still look like these, exactly like this here. There's your BMD score, your T score for like, usually this for osteoporosis, here it says young adult, and then you have your Z score, which is based off your age. And this one's based off your ethnicity. Your T score is based off your ethnicity, and Z score, it looks like it's your age. So DEXA scans has to do with precision and accuracy. So this is very similar to a lot of other QA/QC type measurements. Two terms that are used in DEXA is precision. Precision is the ability to reproduce the same result when repeated in an identical fashion. You compare it to other scans. Accuracy, how well it reflects the true or actual value of the object measured. Comparison between phantom exposures QA/QC block. So usually every other day we have a QA/QC block. We place it on the table and we'll measure the QA/QC block, and when that's how we measure the accuracy here. Precision is just measuring the same result over and over again, so like the same person, and making sure we get the same results. Patient prep should have exam done 1 week after any contrast exams. Loose clothing, no artifacts in the abdominal or pelvis area. Patients may undress and wear a gown to ensure accuracy. So just make sure there's no buttons on the clothes. So here we have, we can see the bone density scanner going up, just like so. The detector is here, kind of fans this way here. Here's the source. So it goes up just like a fluoro machine. X-ray source goes up and hits the detector up here. They call it a C-arm, but this is not what we consider a C-arm. And it just goes up and down. It doesn't go vertical. It just goes up and down of the on the patient. Let's talk again about radiation safety. So let's talk about exposure. Simply put, exposure is radiation, ionization, and air. This radiation quantity expresses the concentration of radiation delivered to a specific area. To measure exposure, we need a free ionization chamber, and that's what this is right over here, measured in coulombs per kilograms for SI units and Rankins for traditional units. So this is the old measurement tool, the Rankins, and now SI is the most commonly one used. SI is what we'll use on your exam, on your registries. Number of Rankins for exposure in air is multiplied by 2.58 times 10 to the negative 4 to convert to coulombs per kilogram if you're converting it from Rankins. Now, if you're converting coulombs per kilograms to Rankins, it's divided by 2.58 times 10 to the negative 4. For X-ray equipment calibration, because of the output of an X-ray machine is measured with an ionization chamber. So again, usually physicists will come once a year and they'll bring an ionization chamber that they'll hook up, that they'll place on the table, and they can measure the amount of radiation ionization. All right, so this is how it typically looks. Again, usually not a lateral, but in this case, you can see blocks L1, L2, L3, or L4 are measured. It gives you the T-score and the Z-score. Again, the Z-score has to do with age, and the T-score has to do with like the sex and the ethnicity. Forearm, again, is a common alternative site if spine or hip has metal replacements. Bone density tech role. Usually the bone density tech operates a bone density machine, usually a DEXA machine. They explain the procedure to the patients, position and ensure accurate and precise images. It's usually an outpatient procedure. Bone density tech work schedule. It's not usually a full-time bone density tech role. You're hired as an outpatient X-ray tech and perform X-rays and bone density scans. It's usually Monday through Friday outpatient clinics, some Saturdays. Outpatient type work hours, so basically like 8 to 5 or 7:30 to 6 maybe. Bone density qualifications. Techs do not need to be credentialed to bone density to perform a bone density scan. The bone density credentials are ARTBD, so you can be registered in this, but it's not necessary. Must have experience in radiography. Some are hired from their clinical rotations. Bone density training. Various training programs for bone density, seminars, online courses, on-the-job training. To become certified bone density tech, need to fulfill the clinical education requirements for bone density tech. Needs 16 hours structured education through ART, according to ART. Bone density techs on average make about 70,000 a year, plus or minus 10,000, and basically that's just you being an X-ray tech and then having extra responsibilities. All right, and this should be the end of the presentation. Here is our textbook that we're going to need next semester. So radiation protection and imaging radiography, and it's the 9th edition. All right, thank you guys.